All right, Sarah, we're live.
I'm looking for Heidi.
Morning, Roger.
Good morning, everybody.
Morning, Roger.
Morning.
Anybody getting snow yet?
Shush.
Not yet. Later.
Weather guy said flurries, and I looked at Jordy. I'm like, "Do you see that?" He said the F word live on TV.
Yep.
Not like the East Coast, though. They're getting blasted.
Who is?
The East Coast.
Oh, yeah.
Or will be.
Mm-hmm.
Morning, Heidi.
Morning.
Hey, Heidi.
Hey.
Heidi, are you getting excited? You're going to be the only Heidi, so there'll be less confusion.
No, it's kind of fun to have another Heidi around. It's cute. Growing up, actually, my best friend's name was Heidi. So we were the Heidis, and yesterday I received a gift from her. It's like an old friendship book that we had given each other.
Aw.
Yeah, it was really sweet. That we had written our own little notes in when we were 17. It was really
I have all the Heidi books on my desk.
Oh, cute. It's very special.
Okay. Just waiting for the record button to come on, and then we will get started.
I saw the button go on.
Live is on and YouTube is on. I don't see record though.
Oh,
Oh, are we recording these now?
I don't know. Do we not have to record them? Are they being recorded on YouTube?
They're on YouTube, automatically recorded.
Cool. All right. Then we will start. This is the Public Health and Human Service Board meeting for December 15th, 2020. And we have determined that an in-person meeting or a meeting conducted under section 13D.02 is not practical or prudent because of COVID-19 health pandemic and the related state and local declarations of emergency declared under Chapter 12. The technology we are using allows that all members of the body participating in the meeting, wherever their physical location, can hear one another and can hear all discussion and testimony. It also allows that members of the public present at the regular meeting location of the body can hear all discussion and testimony and all votes of the members of the body. All votes are being conducted by roll call, so each member's vote on each issue can be identified and recorded. And I'm going to do a ceremonial thing here. I'm going to throw this away because it's my last meeting that I get to run. All right, we have the approval of the consent agenda. Does anyone want to pull anything? Nope. All right, can we get a motion to approve?
I so move.
Thank you, Myron. Can we get a second?
Sterling,
Second.
Nope.
Oh, one of us will.
You can.
Andrea.
Go ahead.
Thanks, Ginny. Andrea will second, and we'll do roll call. Dave?
Aye.
Ginny? Oops, sorry.
Aye.
Andrea?
Aye.
Myron?
Aye.
Roger?
Aye.
And I am also an aye, so that is approved. And now we move on to staff report. And that will be the other Heidi. And I believe, Grace, are you hopping in with her? You're on mute. Oh, now we lost her. And Heidi, you're on mute too. There you go.
Okay, I'm here to back up Heidi if she needs it. I do want
Excellent.
to just reflect on the fact that this is a Zoom meeting, and I recall when we first interviewed Heidi, probably 5 years or so ago, it was a phone interview, and I remember she thought that was really great because she was in her pajamas, and at that time that was really novel to interview and work in such casual environments, but not anymore. I'm assuming
Excellent.
she's not in her pajamas today. So.
She's not, she doesn't look like she's in her pajamas. That would be
Actually
okay though.
not.
No.
Yeah, I should be out of the spirit. I should have been.
Yeah.
Since you're talking about childcare, yes, all children are in pajamas. It's the best way to be.
Yes. Yes. So I do have a PowerPoint. I don't know if I can share it or not, or if it's just.
Try.
I wonder. Let's see.
There's a share your screen button at the bottom. It's kind of right in the middle of all those options there.
Oh, there's the PowerPoint itself. I wonder if that will work to share.
Nice. You're at screen.
Good job.
Thanks.
And then there you go.
And then I think there's probably a present.
And if you set it on that tall thing, there you go. You got it.
Okay. Are you guys seeing it full screen?
Yep.
Or? Oh, excellent.
There we go.
Okay. So, hi everyone. I am the licensor for Cook County currently, and I wanted to give a pretty brief summary of just what that entails for both for childcare, adult, and child foster care. It's really hard to go too in depth with it because it's pretty complicated. Each area is very different. So it's pretty brief, but there'll be time for questions. So I just want to have that disclaimer that it's a lot more complicated than what I'm about to present, but this is a good summary. So each area of licensing is mandated by the state of Minnesota and described in detail through 245A, which is the Human Services Licensing Act, and 245C, which is the Background Studies Act. And then each area has their own rules in Minnesota statutes that apply to each area. So we, as the county, provide recommendations for family childcare, which there are two types. There's traditional family childcare, and then there is special family childcare, which not every county has the luxury of having these types. But they allow for some flexibility, and in our rural community, we found that that's really helpful for our needs. So the two special ones we have are Cooperation Station and the Saplings program in Tofty. So are you sure? So you guys see the full screen? You don't see the sides of my PowerPoint?
I don't see presentation mode, Heidi. It's we can see like your slides and stuff. Yeah.
Oh,
All the way to the bottom to that
that's not what I wanted.
stand with the TV looking thing. Click on that and then get presentation.
There we go. Sorry about that. Here's the way I wanted it presented. So for family childcare, I listed the specific rules. We currently have 3 family childcare providers and then 2 special family childcare providers, like I said earlier. And this process is lengthy, and it includes everything I have listed here. I do want to say that a lot of these became complicated during COVID, and I will have another slide at the end regarding that, but I just can't say enough about our providers in the community. They just really have done everything in their power to stay open and to provide care for kids and families in our community. So The process for family childcare is meant to take no longer than 120 days from start to finish. That sometimes doesn't happen just because of other complications we can have in our rural community, such as not having CPR first aid training available within that time frame, or if they need a fire marshal inspection. The fire marshals, there's very few in the state, so they try to make their trips up here when they are doing their other work, doing inspections for hotels and things. And then also if they have any sort of work they need to do on their home, that can take some extra time to get all of those complete. But one thing I didn't add on here, but I put in my article, was talking about the classes of licenses. So there's different types of licenses that they can hold that vary for staff ratio and the amount of children they have and the ages of the children. So it's very specific. In most cases, you really can't have more than 2 infants. So when we hear about having a lack of infant care, that is some of the reason why, is because for safety reasons, the state of Minnesota doesn't allow for more than 2 infants in most licensed classes. And then providers also have the ability to choose. And it can be hard. It can be more challenging to have infants in care when you also are having school-aged kids or toddlers. So it's one of those areas that's complicated, but there are also, just in terms of providing care, but it's also part of whatever licensed class they've chosen to be a part of that compounds that. And then I just put in what the county's role and responsibilities are for the licensed programs. And this really goes for all of the programs that I'll go over. So mostly what I find, I do all of these things, but luckily we don't have to do some of the correction orders or investigating allegations as often as other counties maybe do. We have small numbers. We have really experienced staff. We have the ability to really connect with each other and answer questions and ask questions so that we can make sure that kids are safe. And that's a real benefit for us. But if something were to happen, if there were some sort of maltreatment allegation or significant compliance violations, then we would need to go forward with doing correction orders or investigations. Those are challenging because those can end up with childcare provider facilities being closed, even if it's temporarily, which is really disruptive for families and the providers. So those are always taken very seriously when they occur, with safety of children always being top priority. So moving into child foster care. So I listed the rules there. We have 5 licensed foster care providers in the community that are able to care for children. 3 can care for non-relative children, and 2 are licensed solely to provide care for their relatives. When somebody does become licensed to care for their relatives, they can choose to also care for other children in the community, but often there are things going on that make that challenging in that moment. But I always leave that door open for people, because foster care is a very important service. And we're also very lucky to have really exemplary foster care providers in our community. So the process is very similar to childcare, with the exception of they do need to do a home study assessment, which I like to give people information about that early, because it's pretty extensive in terms of learning about their history and their relationships and their childhood and their background. And I just want to make sure people are comfortable sharing all of those experiences with someone that's likely a stranger. So there is a pretty extensive interviewing process with people who are becoming child foster care providers, even if they're relatives. So that's always something I try to put out there in the beginning.
Heidi,
And
may
then,
I? I'm
yeah.
sorry. I was just going to add something. I think one of the things that I appreciate everything you're presenting, and I just want to add like a complicating factor for foster care is if a child comes into a family's home in foster care and there's a maltreatment report related to the foster care providers, that child has to leave and they cannot return. And that license is then complete, correct? They can no longer be foster care providers. It's a really high bar. So we expect a lot of the foster care providers. So that is why the review process is so intensive. The bar is really high.
Mm-hmm. Yeah, that's a really good point, because childcare providers are doing a lot for families, and but foster care providers are being the parent in every aspect. So so that's why we really need to have that in-depth assessment of people when they are looking into doing this sort of service. And yes, maltreatment, generally children that are going into foster care have already experienced maltreatment, likely a significant amount of it. And it is a really high bar, like Grace said. So another requirement of foster care providers is that they're required to work really closely with social workers. So they're required to update social workers and meet with them and follow the out-of-home placement plan. And it's a great benefit to everybody to have an open line of communication there. And it also, when it seems to work best, it's also in conjunction with parents. It's like a little community gets formed so that everyone can be focusing on the child and what they need. That's the goal that we have in foster care. So there's also adult foster care. This, full disclosure, it's not my area of expertise because I haven't actually had to license somebody for adult foster care from start to finish. So we currently don't have any providers that provide this specific service, although we do have one of our child care provider or foster care providers is interested in potentially doing both. You could have a dual license where you provide both child and adult foster care. So we do have one pending application. They also have very similar standards as family child care and foster care, with the exception of they often have, the people that are residing there need to have really extensive history and documentation requirements. And oftentimes there's medication management and other things too that require some additional supports and trainings, and perhaps like equipment training and things for the people that would be residing there. And often people that would be in an adult foster care have significant health needs, whether it's physical health or mental health, or a traumatic brain injury or something of that, something to that effect. So it is a need in our community. That is something that there are people in our community that could utilize a service like that. So if anyone's interested in looking into that service, can let me know.
Most often think about this service in relation to people who are seeking some sort of stabilization, maybe for mental health, and rather than going to Birch Tree Center, if we had a licensed adult foster care home, that would be a nice option for people, because it's really hard to recover 120 miles away from your home and from your family, from the people that you love. And so that Heidi and I have talked about that for a long time, and we've had a few people be interested, but it's definitely a need. There's in Coochin County, there's an adult foster care home that has I think there's 3 beds, and one of the beds is specifically assigned for that kind of thing for individuals who need crisis stabilization. And that would be a dream someday to have something like that available in our community.
It would. It would. So as I mentioned earlier, I just can't say enough about all of our providers during the pandemic. They were asked to do a lot of extra requirements. They're really on the front end of things, having to be in close contact with kids and providing care. And I just want to say thank you to all of our providers. They've just done such a phenomenal job, and they've been asked to do a lot of these things without receiving really any extra compensation or anything beyond their typical
Reimbursement.
you know, it's just, I just can't say enough about it, I guess. So I wish I could do something really nice for everybody, but this is where I'm at. It's giving them a nice shout out. So, and part of it is that, especially with foster care providers, they're working with social workers, and we're asking them to provide care, and we're also just trying to balance the risks and benefits of having children in care and reunification with families, and it's just really complicated. So we're just really grateful that we've had the providers we do who have been really following the guidelines, which is helping them stay open and provide care, and we're just really grateful. And then here's information if anybody's interested in becoming a provider. I have had some people email me pretty recently about wanting to become foster care providers, and that's a great way to get in touch because I can email a lot of resources and information. And I'm happy to do a Zoom call or a phone call or whatever somebody wants to do to get more information. And then I have these resources. I don't know how this can be the most practical, but if this is posted somewhere, this is a nice list of the statutes. The first one is actually license lookup. So anybody can look up any licensed provider in the state of Minnesota and look up like what class of license they have or what type of license and whether they're active or not. So that's kind of a handy tool. And then the bottom one is talking about how to become a child foster care provider. So those are helpful. And that's it. Like I said, I know that was kind of a brief summary of just each program. So if anyone has questions, happy to answer them.
Does anyone have questions for Heidi? Myron, go ahead.
Yes, Heidi, thanks for all you do. Do we have any idea of how many are on this so-called waiting list, or do we have anyone on the waiting list? Do you have any knowledge of that and how it's obtained?
Yeah. For which program? For
Be childcare, excuse me.
Childcare?
And all levels. Yeah, I'm
all
sure
levels.
that might be a problem. Yeah.
Okay. Yeah, like people wanting to apply for becoming providers.
I'm wondering if there's a waiting list of parents who would like to have children in childcare and it's not available.
Oh, yes, that's a good question. So, and part of the complication with childcare is that they are their own. It's not really, well, maybe it's not a complication. Just part of the deal with childcare is that they are their own small business, and so I'm not a part of each aspect of that. So a wait list piece isn't something I would necessarily have access to. But it's a really good question.
Okay.
And
I think it's hard to know how many people are waiting because anecdotally, I think we've learned that a lot of families have just chosen to switch out their work opposite shifts, or one parent will not work in general. And so if there's nothing available, why wait? You know, we have to have a job. So I think it's a complicated issue.
It is. It is. And I should mention that there's also, we do have a childcare center in our community too, which is the Cook County Childcare Center located at the YMCA in the school. That's just not a program that the county licenses anymore. That's a state licensed program.
Okay.
So, so they would also have their own wait list and their own process for how
Okay.
to accept children. They have higher numbers there because when you are a child care center, there's different requirements and there's a different staff to child ratio for those types of programs too.
Okay. All right, thank you.
Yeah, thank you.
Dave, go ahead.
Thank you, Madam Chair, and thank you, Heidi, for the presentation. Very nice and good to get overviews of the programs. And I guess in regards to kind of the crisis care like PHHS, what would be our ideal for Cook County if we could provide all that we needed to or all that we could? What numbers, what size or scope are we talking about, just so we can have some idea?
Yeah, I wish I knew an answer to that. And Grace could probably jump in too, but I know that it really ebbs and flows, and there are times when we just feel like we need a lot more, and then there are other times when we aren't utilizing, especially foster care, where we aren't utilizing that service as much. And for foster care specifically, we are really lucky to have increased our child protection staff and team so that we're doing a lot of preventative work. So there are less children in out-of-home placement. However, some children need to be in out-of-home placement, and we have so far in the 6 years that I've been here, we have very rarely had to place children out of county. And if we were, it was with relatives or into like a specialized residential treatment setting that we don't have available here. Would you say that too, Grace?
Yes, I was remembering the challenging times when in the middle of the night you'd be driving a child across the state to Grand Rapids or someplace to place them in foster care, and just our whole shift in how we're providing services and greater understanding of relative foster care, which is you can place a child with a relative without that individual being licensed. I think that's a real benefit. So from the child standpoint, I think we're doing okay. But Dave, to answer your question about the adult crisis, I think if we had a couple of homes that were open to providing that level of care, it would be a great benefit. I think Heidi makes a good point that it's a lot of work to become licensed, and then you're geared up to provide this service, and then for 6 months nothing happens, and then in 2 weeks you're called 3 times to provide the care. So it's hard to plan your life around it. And so but yet I feel I'd like to learn more why Couchiching's service is used more. It could be they just have a bigger community that's accessing that service, but it's been really nice for them because they've just been able to people have been able to stabilize and in their local community, which is something, a goal that we have. So we would like that.
Yeah.
So some would be better than not, but it's really hard to nail down a number because, like you said, ebbs and flows, and
Yeah.
and right now it sounds like there's one pending, right? Or but otherwise we have none.
If we had people would be duly licensed, I think that would add some flexibility. So we can check into that.
Mm-hmm. Yeah, and that's what we're working on right now. Is it's actually a child foster care provider who would be willing to do the service. And I apologize, I didn't hear the part that you were specifically asking about adults. I apologize. But,
no problem.
Okay.
Yeah, thank you very much. Just looking for perspective.
Yeah.
Andrea, you have a question?
Yeah. It was it was close to Dave's question, but is the program in Couchiching County, is that like a oh my gosh, what's the word? Is it like a corporate program, or is it just somebody's house that they have space in?
I believe it's a licensed adult foster care home, licensed by the county and not a corporate setting. But I'd have to
Okay.
clarify, but I'm fairly certain it's not a corporate setting.
Has there, for our county, so I've worked in adult foster care for almost my whole career. So it seemed interesting to me when I moved here that there really was zero here. Has there ever been interest by like businesses like REM or Dungarvan or any of those sort of adult foster care providers to come into our county?
Not that I'm aware of.
Yeah, it's an interesting question. Yeah, because there are so many.
Like Duluth is sort of the mecca for that, so maybe that's
Yeah.
why, you know, it's the
I think
place
I think there's a
where everybody
moratorium.
ends up.
I think there's a moratorium on licensed foster care, adult foster care homes right now. I have to double check on that.
Hmm,
Interesting. Okay.
yeah.
So Andrea, when you think
Wondering,
on the top
there's-
of your head right now, families have taken on the responsibility and they've been able to handle it for the ones in our community that need that.
Yeah.
I don't
Or-
think anybody's providing it, and I think there's a lot of people just kind of hanging out there doing the best they can on their own.
Yeah.
And so when people need a higher level of care, they have to leave the community or they don't get the service at all. I would say that that's probably more accurate.
Yeah. If there
Okay.
was an option, my sister would be here. So,
Yeah. Interesting. There's a house for sale in town that I feel would make a beautiful adult foster care home.
Mm.
Every
I know
time I
which one
see it, yeah, every time I see it, I'm like, this is designed for adult foster care, so that you know the wheels start spinning, and you know. Okay, thank you.
For sure.
anyone else
Yeah.
have questions? All right. Thank you, Heidi. Thank you, Grace.
Thank you. Bye, everybody. Thanks for everything.
Bye.
Have a great day.
Thank you.
All right, Allison, you're up.
Didn't jump in quite quick enough to thank Heidi as well, but just want to say thank you to Heidi and for really the excellent work that she does in her role as licensor, for the care and compassion that she brings to a really complicated role. In addition to her role as licensor, Heidi is also our primary intake worker in human services. So she is often the one on the other side of the phone when someone calls looking for services or information about services we provide. So thank you, Heidi, for your great work and for your presentation. I'll start with staff updates. We are actively recruiting, aiming to fill the social work position to provide substance use disorder case management, and licensing will also be a component of this role. The position closed on December 8th. We're in the process right now of reviewing the eligible applicants and scheduling interviews for that position. And again, that was a position included in the 2020 budget. At our last Public Health and Human Services Board meeting in November, you all authorized the use of fund balance in absence of any other funding sources at a state, federal, local grant level to continue to support the temporary public health staff who are providing case investigation contact tracing services. Wanted to give you an update on where we stand with that. Process right now of reviewing and updating the temporary employment agreements for those staff, and we'll be bringing those before the Board of Commissioners meeting next week to review and approve. Last week on Wednesday, we recognized Health and Human Services Worker Day in the state of Minnesota, and I will share my screen quick and read from the proclamation from Governor Walz. Can everyone see that? Doesn't look great. I'll try and make it full screen. There we go. So whereas county, city, tribal, and state health and human services workers are dedicated to improving health, protecting vulnerable people, and providing outstanding public services to the people of Minnesota, through their prevention efforts, administration of programs, and provision of services. And whereas county, city, tribal, and state health and human services workers are responsible for the prudent expenditure of millions of dollars annually and must meet the highest standards of job performance in program and services delivery. And whereas the nature of federal and state legislation necessitates that county, city, tribal, and state health and human services workers continually expand their knowledge, skills, and expertise related to their professions and the needs of the communities they serve. And whereas the state of Minnesota recognizes the valuable public services that county, city, tribal, and state health and human services workers perform each and every day for the health, prevention, and protection of Minnesota. And then Governor Walz again proclaimed last Wednesday, December 9th, as County, City, Tribal, and State Health and Human Services Worker Day. For agency updates, a few updates from public health. We recently sent out a flyer and a media release. You should have received an updated release just this morning, as we had a couple of typos in the times, PM instead of AM for a couple of the Gunflint Trail Fire Hall distribution sites. But this is to distribute some saliva tests that were made available through the State Emergency Operations Center using CARES funds. Because of that, they do need to be used very quickly. And I just want to recognize those who are involved in planning for test distribution, including Jen and Alexis from Grand Portage Health Services, Jim Boyd, Jim Wienanen, and Mike Keyport, Hartley, Andrea, and Kate from the clinic, and Kimber, and of course, Grace Grenager for planning that distribution event in a very, very short turnaround. We're promoting that in addition to the media release on social media, and I'm happy to get the flyer or release out to any other partners that you can recommend or suggest. Otherwise, a big effort right now is around vaccine planning. Just yesterday, the first vaccines arrived and were administered in Minnesota. Locally, what that looks like for us is a lot of planning with local healthcare partners because we have a little different public health service delivery model here in Cook County. The healthcare partners will be primarily responsible for administering the vaccine. Our role is more of in a support, coordination, and assurance. And the early phases of vaccine distribution will be directed towards long-term care, EMS, and healthcare workers. A very frequent communication between Grace and MDH at this point. In human services, the Minnesota special session began yesterday. Just last night, the legislature passed a $216 million relief package that includes small business grants, as well as an extension of the unemployment insurance for another 13 weeks. So right now that is on Governor Walz's desk for signature. I sat in on a weekly meeting with my state Human Services Director Association last week and heard a report from DHS that the anticipated revenue shortfalls at a state level will be much lower than initially anticipated. So that's really good news for state human services and by extension counties, in that we aren't looking at as significant reduction, cost shares, things like that. Locally, we are doing some outreach right now in the area of economic assistance programs, both visual and other media, to connect people with the types of financial supports that we can provide through PHHS. I was recently appointed to a state leadership group involving the Department of Human Services, Minnesota Tribal Nations, and counties. This is my first formal appointment as a MAXA representative. Again, MAXA is the State Social Services Administrators Group, and just attended my first meeting yesterday. There was a presentation from Professor Tad Johnson, who is a Senior Director of American Indian and Tribal Nations Relations for the University of Minnesota. He gave a version of his tribal state relations training that he provides for state agencies throughout Minnesota. Both Grand Portage Human Services Director Jackie Kozlowski and Chairman DeShaw are also on this council, so really looking forward to working with this group and being a part of more strategic change and building at a state and nation and county level. And I'll just read: the purpose of the group is to build strong collaborative relations leading to strong collaborative partnerships, which ultimately result in working together to reimagine and develop exemplary and culturally responsive human services delivery that reduce disparities in outcomes and strengthens the well-being of the individuals we serve. So really looking forward to being a part of that work. Tomorrow, all of our staff within PHHS will be participating in a half-day workshop. This is facilitated by a group called Circles International. We were able to access some grant funding from North Shore Healthcare Foundation that was initially granted a few years ago and we had yet to use for staff training purposes. And the focus of this training will be around staff resilience, as well as understanding the systems of oppression that we operate within human services and how that impacts our work. We are actively recruiting members for both our Public Health and Human Services Advisory Council and our local Mental Health Advisory Council. And in the process of planning our presentation schedule for the Public Health and Human Services Board for 2021. So if there are any programs or service areas that you're interested in hearing an update from, please let me know and we can add that to the list. Lastly, I just want to have Sarah aid me here in, actually, how about I'll take questions before I move on to my last section. Does anyone have questions about any of the staff agency updates I provided?
Doesn't look like it.
Then I'll ask Sarah to share her screen. I have a few things to share. First, want to thank Commissioner Berschheim. This being your last PHHS board meeting. Want to thank you for your years of service to the PHHS board, for supporting our work as a department for many years, for your service on several health and human services related committees, including the Emergency Preparedness Committee and the ARC Committee. Just want to wish you the best and thank you for your support over the years.
Thank you, Myron.
Thank you very much. Thank you.
Also want to thank former Commissioner, now Chairman DeShaw, for his service to the PHHS board as well. I regret that I didn't get a chance to share this with him at his actual last PHHS board meeting, but we'll be sending this to him to also say thank you for his years of service to the PHHS board and support of our work, especially in the area of behavioral health and ensuring that residents have access to mental health and chemical health services. So thank you so much, Chairman DeShaw. Lastly, I want to thank Commissioner Dukirk for your years of service as well to the Public Health and Human Services Board, including several years as our PHHS board chair, and for your service as well on the Regional Community Health Board and on our local Mental Health Advisory Council. Thank you, Commissioner Dukirk, for being a champion of breaking the stigma around mental health in Cook County. Thank you so much for your support and service.
Thank you, Allison.
And that's all I have for updates. Thank you.
We just had a little argument at the DMV yesterday because the new MinDrive system has a question that says, would you like a mental health identifier on your driver's license and an autism identifier. And it's not a required question, but you know me, I ask it. And Sandy is uncomfortable, obviously. And she's like, don't ask people that question. And I said, if you didn't ask me if I wanted a mental health advisor on my driver's license, I would be angry with you. So I can't wait to see what that does and how the education goes into law enforcement and how that will help people who may need assistance. I'm very hopeful that having those identifiers, if you can imagine, if you are on the spectrum and you're having a situation and law enforcement is coming up on you, and when they pull up your record, they see that identifier and they're able to deal with the situation differently. So I know I'm a pie in the sky optimist, but I am really hopeful that this means good things for the world. And Dave, you had your hand up.
Thank you, Madam Chair. I was just hoping for a little more info on that, but you explained it a little bit more, and that was enough for me. Thank you. That's awesome.
Yeah, I did try looking it up, Dave, and I tried looking up, there's like 17 states that have the identifier, and I'm trying to figure out how it works and how it translates. And maybe I'll talk to Pat Eliason and find out if he's aware of it and how to resolve that. When I just think of the people that come to our community to commit suicide from other places, you know, I wonder how that would translate and how we can help people. And I wonder if the response to an emergency is different with those identifiers. When you think, you know, when I think if you call law enforcement and say, I have a child in duress, well, if they see that identifier when they run the license, then they know it's a history, or they know that there's a situation and they can handle it differently. I don't know. I'm just, you know, I'm always extremely hopeful. So go ahead, Dave.
Yeah, I was thinking the same thing. I was thinking how great that would be to have that as a way for individuals to kind of take a step back and do another assessment of a situation, because I know the training really encourages that sort of thing. And then, of course, the cynic on me is saying, is this going to affect insurance? Or, you know, what are the other, or, I mean, there must be a law against that kind of discrimination. But it's very interesting. I'm really happy to hear about that.
Excellent. So the next item we have on is the Public Health and Human Service Board Chair election. And I just want to kind of get a feeling from the board. Do we do this now and have a chair step in for January, when we'll have at least 2 new commissioners on board, and then another one coming in February? We do have a vice chair, which is Commissioner Storley. So the other option is you could move ahead with, if you're willing, Commissioner Storley, to step up into the chair position and hold that until February when you have your full board. So I'm open to discussion. We'll start with Commissioner Storley, since I threw you under the bus.
Yes, I think that would probably be the smoothest way to do it for now. And yes, I would be more than glad to step in for January. Because February, I believe it's the first week of February, so we'll play it by ear. I'll do January for sure.
Okay, Commissioner Bersheim, how do you feel about that?
Sure, I think that's great. Yeah. Thank you on behalf of everyone, I'm sure, Jenny, for doing that. That's good. Good way to proceed.
Roger, what's your feelings on that? Turn the mute off.
I think that's fine.
Okay,
No, sounds good.
Commissioner Mills?
I think that's I'm very comfortable with it. I don't know that there's precedent for doing it before January, but I do like the continuity of vice chair moving into chair position. I'm less comfortable with shaking it up in February, but that is, of course, Commissioner Storley's prerogative, if or the board's prerogative at that point. But you know, I'd say there's less precedent for shaking things up yet again as far as changing horses or whatever kind of metaphor you want to use there.
Yeah,
But
don't
I
call
think
Ginny a horse.
my apologies, not my intention. But that no, I'm very supportive of Commissioner Starley becoming chair.
Great. Andrea, how do you feel?
It sounds great.
Well, Ginny, that kind of gives you a heads up. No one feels like they have this urgent desire to jump right into that chair position, but thank
Okay.
you for doing that. Allison, if you could get that on later next year. Excellent. So we'll move on to committee reports. Arrowhead Economic Opportunity, Commissioner Mills.
Nothing to report at this meeting.
Okay, how about Arrowhead Health Alliance?
Nothing to report there. The meeting was postponed.
Okay. And Myron, your Arrowhead Regional Corrections?
Yes. Yeah, at our last meeting, the main discussion was on performance review of the executive director, the CEO, Wally Kasich. So that was basically the substance of the meeting. And we did grant cost of living raises to a couple of the unions. And that's basically it.
Okay. Was that a tough decision considering the current economics?
No, I think that what they did was they took a look at the area and Duluth and, what happened in St. Louis County. That seems to be the big driver for, St. Louis County is the biggest employer. So, and I think, boy, I'm sorry you caught me off. I think it was something just under 2% cost of living. It was sort of and don't hold me to that exact number, but it was somewhere in that area.
Okay. Next, we have Arrowhead Regional Development, Commissioner Sorley.
Nothing really to report there. And I think in January, I'm going to change this to NACO. And if I do ever have anything from Arrowhead, I will report it. So I'm going to give a small report from NACO. Just to refresh your memory, NACO stands for National Association of Counties, of which there's around 3,000 counties in the United States. And we meet once a month as a steering committee, and this is for legislative priorities. So I'm just going to highlight a few of the ones that will be voted on this afternoon. Or I'll hear about it anyway. And there again, it's to the federal, and that is because we meet monthly, and then we do have two countywide, United States-wide meetings every year, one in the summer and one in following in the early winter or late winter, depending upon how that all works out in the COVID situation, of which, if you remember, I was part of that the first week of March this year. So some of the things that we're considering is federal, state, local, and partnership in delivering essential Medicaid services, legislative and administrative changes for counties to enhance the ability to improve health equality, targeted funding to help counties combat addiction and its effects, that will changes that will enhance comprehensive behavioral health issues and services, and to address and combat intergenerational poverty as it relates to health and well-being. And I really never thought about that, intergenerational poverty. And I think that's one that was added to the list earlier this year. So those are some of the considerations on the federal level. That's my report on that.
Thank you for your representation on NACO. It's really important. It was a long time that we did not have that, and you stepped right up. So thank you so much.
Mm-hmm.
Dave, Community Health Board.
Well, we met yesterday, as a matter of fact, and let's see, there were kind of annual summaries given by staff and the various areas, and that was really great just to hear of the impact that the CHB was able to have even during the pandemic, or you could even say especially during the pandemic. So that was really great. Also had a presentation from Dr. Tim Fall from St. Luke's, and that was about screen time and the effects on children. And it was interesting in that it wasn't so cut and dry. There's conflicting evidence out there about the effects of screen time, and I had some other assumptions, and I guess, you know, a lot of the research is older from the age of television versus the age of you know, phones and tablets and devices, but there is still research being done, of course, and data coming in, and there is, again, conflicting evidence regarding phones and that sort of thing. There were just some statistics that were, I wouldn't say staggering, but about the percentages of kids who have phones or are on phones for more than 6 hours a day, and that kind of thing. Also, there's been kind of this ongoing question about what to do with some monies that are sitting on the state's books. So far, everything has been fine. The state has been fine with us just kind of rolling those over from year to year as our reserve funds. But our CHB director had a friendly conversation with somebody who said, yeah, you might not want to have that as a long-term situation, because it is state money and they could take it at any time they see needed. And so options about how to work that a little more securely were discussed, and I think we're going to be assigning it to a county, and they're going to check with the state auditor to make sure this is all legit. And there has been past conversation with the state auditor about it, and it was all legit, but double check, right? So giving it to a county, and then that county more or less pays back with county levy funds, and then it'll stay as CHB money versus state money, and that seemed like a really great way to do it if we can do that legitimately. And there are other options if we want to do something different instead, but it gets a little bit more complicated as far as all the counties paying back or spending down that reserve and then putting back into it. So this seemed the most straightforward as long as the state auditor gives it the go-ahead. I think that is the long and short of it. Allison, do you have anything to add there?
I unfortunately had to miss the CHB meeting yesterday for the DHS Tribal County meeting.
Roger, did you have a question? Or you're just getting ready for your next step? You are Public Health and Human Service Advisory Council.
Yes, just want to make sure I unmuted in time. We did not meet in December. We will meet next in January. There is, as Allison noted, a subcommittee working on recruiting and widening the diversity of the Public Health and Human Services Advisory Council. We'll have a report on that for the January meeting, and hopefully for the January meeting of the Public Health Board as well. So that's what we're working on right now.
Have you determined the diversity that you need or that you're desiring?
That's what we're working on.
Okay.
What we're working on.
Great.
Exactly.
Andrea, Local Advisory Council for Children and Adult Mental Health.
Yeah, I was not at the last meeting, sadly,
that's
so Roger offered to give the update since he was there.
All right, Roger.
Be glad to. The LAMHAC discussed the ongoing challenges of isolation and impact on mental health during the pandemic. Members discussed the ideas for promoting the community support line in ways that emphasize the confidentiality and availability of the resource. And the group also reviewed a summary of council activities from the first year and a half and feedback from outgoing member surveys. This will be discussed further at the January meeting, along with the continuation of our strategic planning process. Do you have anything, Heidi or Allison, you want to add to that?
No, it was a very short meeting.
It was. We missed you, Andrea.
Yeah,
So that's all I've got.
thank you. Ginny, Healthcare Planning Committee.
Yes, we always meet the first Friday of the month. An interesting decision in Grand Portage is that Jennifer reported that they have chosen to do the Moderna vaccine only because of the fact that it doesn't have to be kept at Arctic temperatures. So that's a good plan there. So I'm not sure how the rest of the county is going to deal with it. At that time, there was nothing reported from Kate or Kimber. Kate reported that the new pharmacist is on duty and ready to go in January. So all things look good that way. At that time, the clinic was having some technical difficulties, and I don't know if that's still been resolved. I know it's been a problem. So very soon or no soon. No, you're shaking your head.
It's not resolved presently, and there is not there has not been a date determined as of yet.
Okay, wow. I guess other places are having trouble too. So who knows how widespread this is. Lindsay reported that the Luna Fest was very successful, being that it was done with our present technology, and it really benefited the organization. And that's my update there.
Thanks, Ginny. North Shore Collaborative, Dave.
We have not met since last meeting.
Okay, Emergency Preparedness, Commissioner Bershine.
I was absent. I had a conflict, but I know that Commissioner Mills attended, and I think Administrator York.
Commissioner Mills?
Thank you. Yes. Yeah, largely, it's a roundtable discussion to get the various goings-ons of the organization, different organizations with right now largely the pandemic. So Grace gave an update of much like we get from her Tuesday mornings and at our regular meetings. Also, one thing that I learned was about the clinic's ability to administer the monoclonal antibody treatment, and that's something for if somebody does have COVID and does have mild symptoms and is in a particular weight range, I believe, or they have a certain criteria for it, then the idea is it will minimize COVID's ability to get worse. And so that was neat to hear that that's an option. And it has yet to be administered, I guess, at that point. But I'm just happy to hear about the different tools we can have to fight this disease. And there was a fair amount of discussion about the vaccine and distribution as well. But I think that was by and large it. Unless James, would you like to add anything?
No, that was a great summary, Commissioner Mills. I have nothing to add.
All right, so our last item is for the good of the order. As we said last week during the commissioner meeting, Allison has been with us for 8 years, so a big shout out to Allison. And then Sarah, please share with the group what happened recently to you.
I finished college. Woo!
Hey.
Way to go.
Does anyone else have anything for the good of the order? Myron?
Yes, I would just like to thank you, Heidi, for all your leadership with this group. You've been, I think, for several years that I've been aware of that you've been chair, and you've done an excellent job with it. And I know you're very committed to that in our community, and thank you for that. And I'm sure you'll stay involved. Would encourage you to do so.
Yes, I am staying on the Mental Health Advisory Council. And Myron, we couldn't do it on our own. So thank you. The continued support of public health takes all of the commissioners to support it. And you have also equally been an important part, and your work on social justice has been very important. And I know that's dear to you. So we know you'll also stay involved. So, and I'm sorry to anyone watching who thinks that we're all mushy and like to pat each other on the back, but you know, it's all about promoting good public health. And so that's what we do here. With that, we will adjourn. Myron, 10 o'clock for committee of the whole.
Yes, yes.
All right.
See you all in.
Okay. Have a good holiday, everyone.